Understanding colon cancer, a comprehensive guide. Colon cancer is a serious disease, but with awareness and early detection, we can significantly improve outcomes. This video aims to provide you with essential information about colon cancer, its risk factors, prevention, and treatment options. We hope to empower you with knowledge and offer support throughout your journey. Colon cancer, also known as colorectal cancer, begins in the large intestine or colon. It often starts as small, non-cancerous clumps of cells called polyps. Over time, these polyps can become cancerous if not detected and removed. As per WHO, among individuals under 50, CRC incidence has been increasing by 2.4% annually, with mortality rates rising by 1% per year. In 2020, over 1.9 million new CRC cases and more than 930,000 deaths were reported worldwide. Now let's talk about its risk factors. Non-modifiable risks. Age. Risk increases with age, particularly after 50. Family history. A family history of CRC or polyps elevates risk. Genetic syndromes. Conditions like Lynch syndrome and familial adenomatous polyposis, FAP, significantly increase risk. Modifiable risks includes diet, high consumption of red and processed meats, low fiber intake. Physical inactivity, sedentary lifestyle contributes to risk. Obesity, excess body weight, especially central obesity, is linked to higher CRC risk. Alcohol and tobacco, both increase CRC risk. Type 2, diabetes, associated with increased CRC risk. Regular screening, begin screening at age 45, earlier if there's a family history or other risk factors. Dietary modifications, increase intake of fruits, vegetables, and whole grains, reduce red and processed meats. Physical activity, engage in regular exercise. Maintain healthy weight, aim for a healthy BMI. Limit alcohol and avoid tobacco, both are modifiable risk factors. Vitamin D, adequate levels may reduce CRC risk. Symptoms. Colon cancer may not cause symptoms in its early stages. However, as the disease progresses, you might experience changes in bowel habits, rectal bleeding, abdominal pain, unexplained weight loss, and fatigue. If you notice any of these symptoms, it's important to consult your doctor promptly. Diagnosis. Diagnosis typically involves a colonoscopy, where a long, flexible tube with a camera is used to examine the colon. Biopsies can be taken during the procedure to confirm the presence of cancer cells. Imaging tests like CT scans and MRIs may also be used to determine the extent of the disease. Treatment for colon cancer depends on the stage and location of the cancer. Common treatments include surgery to remove the cancerous tissue, chemotherapy to kill cancer cells, radiation therapy to shrink tumors, and targeted therapy or immunotherapy. Your doctor will work with you to develop a personalized treatment plan. The prognosis of colon cancer strongly depends on the stage at diagnosis, overall health, and response to treatment. When detected early in stage 1, the 5-year survival rate can be as high as 90%, offering excellent chances of a cure. However, prognosis declines as the cancer advances. Stage 3 cases have a 5-year survival rate of around 53 to 72%, while stage 4 drops to 12 to 15%, due to spread to distant organs like the liver or lungs. Innovations in targeted therapies, immunotherapy, and minimally invasive surgeries have improved survival rates, especially when treatment is guided by genetic profiling. Routine screening and early detection remain key factors in improving outcomes. Recent studies highlight a potential link between early life exposure to colobactin, a toxin produced by certain E. coli strains, and increased CRC risk in younger individuals. Mutations associated with colobactin were found to be 3.3 times more prevalent in patients diagnosed before age 40 compared to those over 70. Advances in research and treatment are continuously improving outcomes for people with colon cancer. Early detection and advancements in personalized medicine offer hope for a brighter future. By staying informed, taking preventive measures, and seeking timely medical care, we can work together to reduce the impact of this disease.